Mari McInerney from Croaky here, and I'm talking to Dr. Helen Schultz here at our inaugural CroakeyGO Melbourne walk, and we're actually at Dyke Schools at the moment on the country of the Wurundjeri people of the Kulin Nation. So thank you very much, Helen, for coming. Can I ask you first, what's brought you along here today?
Well, I'm a true Melburnian, so I was really excited to hear that Croaky was having walks and started in Sydney and approached the Croaky team to see if there would be a Melbourne one. This is my backyard, and I'm very, very lucky to live here in inner city, and you can see the inner city and the juxtaposition with nature and being on such a sacred site as well. I couldn't give up the opportunity, but I also came along too because I've been working very hard, as have a lot of us health professionals, in the space around mandatory reporting of all health professionals and our real concerns that are occurring as far as whether or not this is actually impacting on doctors and nurses and other health professionals' ability to seek help. And really, as I was explaining before, none of us would disagree that we need a reporting system, that the public has to be safe first and foremost from any doctor that's impaired and places a patient at risk. But our big concern is that most health professionals don't really know what constitutes a mandatory report to our regulatory body. And even though it's very simple, that the doctor must be operating or practicing under the influence of drugs or alcohol, or putting patients at significant risk because of untreated illnesses. But what we've been doing in the last 6 to 12 months, myself and other tireless campaigners like Dr. Mukesh Harkawal, Dr. Brad Frankham, we've been lobbying state health ministers to change this legislation, which came in about 2010, and different states adopted the laws around mandatory reporting in different ways. So there's a lot of confusion about that.
They're all different across jurisdictions.
Yeah, we've got such a wide-reaching way of adopting mandatory reporting laws in Australia as well, and there is, the example of Western Australia, who did not adopt the mandatory reporting laws, right through to New South Wales, where there's almost a double whammy in that if someone is actually come to the attention of AHPRA or the Healthcare Complaints Commissioner, and if they're actually placed under the Mental Health Act, their registration can be suspended immediately. And we know that has a devastating impact on all health professionals and may actually, as we know, doctors and nurses often present very late for mental health care because they're very concerned of stigma and also fear. If they present very late and they do need to be placed under the Mental Health Act, particularly in New South Wales, it is the end of their career.
So with patient safety foremost in mind, then what are you saying then? How do you resolve those two, competing?
Yes, yeah. Well, no doctor would disagree that we need a notification system. But what our concern is that there is a one-size-fits-all approach to the notification process. So if you're Dr. Helen Schultz or you're Dr. Jane Patel, you get treated the same way during the assessment and investigation process. The investigation process itself can be very long and arduous. It can have a significant detrimental impact on the person that's been notified. It may actually come to light that there was actually no substance to the notification, but nevertheless that doctor may take that information very seriously and decide to perhaps end their life, and we have seen cases of that. So we're all in agreement there has to be a notification process, there has to be patient safety first and foremost, but doctors need to be kept safe too, and certainly not put at risk because of this process.
And something happened yesterday with COAG. Can you,
yes.
Where are we at with this?
Yes, well this all came to light in 2015 that there needed to be a Senate inquiry into the mandatory reporting process, and it largely stalled because of changes to government. It was off the agenda, and because of our work and advocacy and pressuring on state health ministers, we have actually managed to get the ears of both the New South Wales and Victorian Health Minister as well as our Federal Health Minister Greg Hunt, who are now stating that they will take this matter to the next COAG meeting and table it, and finally hopefully get a resolution that we hope would actually lead to an end to mandatory reporting to our regulatory bodies.
Is there best practice internationally that we can draw from?
The UK has the General Medical Council. There are similar processes around the world in all different ways. The issue is around the mandatory component of that. There is new data coming out of the UK that particularly people being investigated by the General Medical Council, the actual notification process itself has actually been the trigger for suicide in some of the people being investigated. Yeah.
So what should people be looking towards?
Well, we hope an end to mandatory reporting, that there is no more confusion about if you go to see your doctor for what is a very treatable common mental illness such as depression and anxiety, that your doctor is going to feel that they can just treat you like another patient, as we should, and that we can have access to best practice care, nurturing, reassurance, get back on the road, get back to treating patients safely and happily, and that mental illness isn't always seen as an impairment, because at the moment the wording of the legislation really does state that if you have a mental illness, it is lumped into the same category as being an impaired doctor, and we just want to get it right away from that.
Fantastic, Helen, thank you. We shall walk on. Yeah?
Yes, the sun's out still.